So the penis is composed of, it's typically a cylindrical shape, which is composed in different layers. Those layers being all the way from the deep layers, which is the buccal fascia, covering the corpus cavernosum. Then we have the dartos fascia, and then we have loose areolar tissue, and then we have the skin. All of these layers form a cylindrical shape. Now, the thing is, these layers are all sitting on top of each other, and they are under a sliding mechanism, so they all slide over each other, albeit the buccal fascia is quite tightly adherent to the erectile chambers or the corpus cavernosum, but the layers above that are very loose and sliding. So what happens is we inject the filler between the buccal fascia and the dartos fascia, so it's quite tightly ground in between those two layers. But as we just spoke about previously, the penis is under constant sliding mechanism, sliding motion. And what happens is, even though on the day we can, even with the most perfect technique, the perfect amount of filler for the individual and the perfect molding technique, even given all of those factors, because the anatomy of that part of the body isn't a fixed place and it's under constant sliding motion, the filler can sometimes, once most of the filler has set, there may be one or two areas, because of what we just discussed previously in regards to filler slightly moving out of the place of the injection point, those areas that are lacking a bit of a filler will need topping up. So we always recommend 2 sessions, because on that second session we can almost get a perfectly shaped cylinder, keeping the penis looking extremely natural. But what happens is, a lot of clients don't just want that, they want to add a bit more, which is totally fine as well. So we say on the second session, anywhere between 5 mils to correct any slight asymmetry, to 15 mil if you want even more gains on top of what you achieved in the first session. There's also lots of evidence, and what we see in practice, well, for the last 10 years anyways, that filler, when you inject filler in the same area twice, the longevity of the result is very significant. It almost doubles the length of the result. So that is why, even if it is just 5 mils of a little top up on the second session, that is why we recommend 2 sessions. Then after that, you can then go into the maintenance program, which entirely depends on your goals and what you hope to achieve going forward.